Hello everyone, thank you so much for joining me today. My name is Jaymee Turner and I am a school counselor for the district. I am primarily at Starlight Elementary, but today we are doing a presentation district-wide for everyone in elementary school, middle school, and high school. So I thank everyone for being here, parents, students, teachers, administrators, and everyone else that could join us today. So thank you so much. Today, as you know, we are going to hit on a little bit of a hot subject, a social issue that we have on sex education. So something that definitely needs to be discussed and talked about. So we will be discussing some issues, some scenarios, conclusions, next steps that we can all take as a community for this. So first, here we go. So some areas of discussion that we're going to be talking about today. So just a little bit of kind of a run through or overview of it. So children are being exposed to sex and sexual contact at an earlier age than ever before because of access to computers, social media, television, and movies. So how can we as counselors, parents, and students discuss openly and honestly about comprehensive sex education? So some things we'll be talking about today. We have teenage pregnancy, sexually transmitted infections, STIs among adolescents, and education, prevention, and some strategies that we can all take part in. I thank you for your patience. For technology, it's very fun. So just some statistics that we can review before we move on. So according to RECAP, which is the Resource Center for Adolescents Pregnancy, so in 2017, 41% of students reported having sexual intercourse. So 41%. 59% of those students claim to have or used some type of contraceptive method. 25% used birth controls, so that's either birth control pill, IUD, a shot, or a patch. 8.8% of those used both a condom and birth control. So here's some statistics for us in a nice graph, grades 9 through 12. Now again, we are discussing it through the adolescent period, so just kind of remember that. So here's both of ours. So 9th grade, 10th grade, and 12th grade. So as you can see, when they're a little bit younger, they take a little bit more precaution, and then as they get older, either they don't think that they need it or that they just don't want to use it when they get a little bit older. So the percentages actually do increase for boys using condoms, and then birth control pills. More girls at the age grade 12 are actually using some type of birth control pill or the IUD, shot, patch, and so forth. So what's trending within our teenage years or with our adolescents? So the teenage pregnancy rate, like I said, was about the sexual having sex is about 41%. So the teenage pregnancy rate is declining in the United States, so it is going down, and in California. However, the percentage of teens with sexually transmitted infections has increased. So pregnancy has gone down, but the amount of STIs that our children are being exposed to and getting is actually increasing. So that's nationally and on a state level. So some things we can review pretty quickly. So this study was done a couple of years ago, but pretty accurate. So ages 15 through 19-year-old girls, 194,000 babies were born. Our birth rate was 18.8% per 1,000 women. Teen birth rates vary by age, race, ethnicity, and by state. The United States still does have the highest teen birth rate out of all the industrialized countries. So teens use less effective birth control, and they use these methods inconsistently. So young people ages 15 through 20 acquire half of all new sexually transmitted infections. Half of what is being reported. And 1 in 4 sexually active girls has an STI. just go ahead and think about that for a minute and think about what they are being exposed to and why prevention and education is so important. So again, teen pregnancy in the United States, ages 15 through 20. So 1 in 4 girls will become pregnant. 1 in 4 girls has an STI by the age of 20. And 5 in 10 African American girls and Hispanic girls will become pregnant by the age of 20. So sexually transmitted infections, ages 15 through 20. So we have chlamydia. These are some of the top. Now, these aren't all of them, obviously, but these are some of the top that are being spread throughout the 15 through ages 15 through 20. So there's chlamydia, gonorrhea, the human papillomavirus, and HIV and AIDS. So as you can see, there actually has been an increase in all of those STIs within our adolescents between the ages of 15 and 20. So there's been an increase in chlamydia. There's been an increase in gonorrhea. 79 million Americans, most are adolescents, are diagnosed with HPV. HIV and AIDS. So adolescents account for 21% of all new HIV diagnoses in the United States. How can we control this? How can we as a society and here in our community, how can we help these kids and educate them a little bit more as to what is actually really out there? So, big question is why, if they have access to this and they're being educated, why aren't they using the contraceptives? So, 31% thought, oh, I can't get it, it won't happen to me. I mean, so many people think that. You hear that all the time. It's not going to happen to me. It may happen to my friend, it may happen to him or her, but it's not going to happen to me. So 31% said that. 23%, they didn't want to use it. So either I didn't want to take the pill, I didn't want to use a condom, they just didn't want to do it. 22% really didn't mind if they got pregnant or if they got an STI. So either it didn't really matter to them, it wasn't on the top of their mind, obviously, at the moment, so they didn't mind it. Trouble getting birth control, 13%. So that's trouble getting birth control, either through health care, didn't want to tell their mom about it, just didn't know where to go, maybe. That could be part of the reason, too. Side effects from contraception, 9%, and thought she or her partner, he or she was sterile. So 8%. So, oh, I can't ever get pregnant or I can't get an STI. That's what that is. So effects from teenage pregnancy. So if this does happen, some of the side effects or some effects, that will happen. So obviously there's going to be academic, personal, and social effects that will take place if this happens to a teenager. So on an academic level, lower educational attainment, the dropout rates among girls that become pregnant when they're teenagers increases. They obviously don't feel like they have the time, whether when they have the baby, who's going to take care of it, daycare, childcare, things like that. So what's going to happen? So the first thing that goes, obviously, would be school. How can we help those girls who do become pregnant? How can we help them with their education moving forward? How can we keep them either in school or in an online classroom or something so they can finish their education? Teen mothers experience greater rates of postpartum depression. Obviously, there's all these pressures. They're, in their adolescence, and they have all these pressures going back and forth. And then, they have a new child and they're a new mother, and obviously they're going to go through a little bit of a depression. Personally, so feeling like they're not going to be accepted by their peers. This is going to happen. They can't hang out with their peers anymore. They can't do the certain things that they were doing. They, unfortunately can't be involved in sports. And this goes for both boys and girls. It's not just the girls getting pregnant. We have to really kind of think about that. It's both of the boy and the girl, and we need to focus on that and really push that. They both need to be responsible. Personally, few teenage mothers and fathers attend secondary education because now all of a sudden they need to get a job and they need to support their new family or their new child. Grandparents and family help, you see that a lot where grandparents are now taking the role as parents or helping with the parent because they are young and they do need to finish their education. Socially, About $9 billion goes to public assistance, child health care, and foster care to those parents or adolescents that become or have babies between the ages of 15 and 20. And society usually considers teenage pregnancy a social dilemma, so it's a burden on the society. And they face, humiliation and negative remarks from peers and people. So that needs to be a cultural thing. We need to change that and actually support these kids. So there are effects on pregnancy, and there's also effects on sexually transmitted infections. So academically, you're going to have lower self-esteem with your diagnosis because you're going to think about that all the time. So it's going to be in your mind. You're not going to want to go to school. So not wanting to go to school means lower test grades, lower test scores, not being involved in the things that you were before. Personal. It can lead to health problems in the future because some STIs are not diagnosed right away. They can lead to cancer, infertility, and other results later down the road that maybe at 15 you didn't realize it, but at 25 you're going to. You're going to be ashamed, embarrassed, and could affect your future relationships. Don't forget, young males also get STIs. This is definitely not just a girl or women thing. Men get them as well, and boys carry them. So their infections they often go undiagnosed, and I think possibly that's why they get spread so quickly. They are undiagnosed and unreported because they are less likely to have any symptoms. So that is important for us to educate our kiddos with that as well. Socially, it's obviously going to increase our healthcare costs and the spread of infection through the community. So it's going to go to one after the other if it becomes undiagnosed. So how can we help? How can counselors, students, and parents, how can we help with this? So a couple of things. So my job as a counselor is to provide a comprehensive and inclusive sex education program that encourages both abstinence and safe sex practices for all. Because like we just said, 41% of our kids are going to do it. So how can we protect them and how can we educate them? And so communication with parents and students about the program, so that's my job, is to communicate with the community, with you, as to how can we do this as a community? How can we do this for our kids? About the program, what can they expect from what I give the kids, what we're talking about, and before I present it to the students. So it's super important as counselors that I communicate this with the parents and students. So they need to be aware and they need to listen. I know it's hard. But pregnancy and STIs can affect people of all economic level and status. It does not matter who you are. It does not discriminate. Being sexually active can have consequences: unwanted pregnancy, STIs, social and emotional distress. And if you have questions, you need to ask. Ask questions and be safe. Be safe. And as parents, so children are exposed to information about sex from different sources and at a younger age than ever before. Friends, social media, computers, school, all of those factors, they are being exposed to this earlier and earlier. The system of sex education in schools is not enough, so you need to be involved. You need to have open communication with your kids. As uncomfortable as the conversations may be, you need to talk about it. We need to have those conversations. Ask questions about what they learned in school. So after they go through this program, have a conversation at home with them. With guidance from your home, your children can still have education on safer sex and contraceptives and still practice total abstinence. You can still talk to them about the safe practices, but then they can also practice abstinence at the same time. We just want them to be educated and we want them to know. So our next steps. So today's youth are inundated with sex by the statistics. A large majority of them are going to have sex. Gotta just put it out there. That is what's going to happen. So we need to educate them and we need to support them and we need to help them. So there's nudity on the internet, sex in the movies, and in popular music. They will be facing sexual pressures, and it is imperative that we shape the way we communicate with them. Providing them with factual information about the transmission, progression, and prevention of sexually transmitted diseases and pregnancy. We need to be open, we need to be honest. And just like I said, open communication. Ask them questions, be supportive, and be there for them. That's my job as a counselor. It's your job as a parent and as students as well. So if there's any questions after the presentation, please feel free to come up and ask. I hope this opens the door to start some communication in your own home. And again, as a counselor, I will do my best to have that open communication with your kids. That's priority for me. Parents, please don't hesitate to contact me at any time. I will leave my contact information. Brochures are actually on the table for you as well to take. So if you have any questions, please let me know. But I appreciate your time this afternoon, and I look forward to hearing from you soon. Thanks. Bye-bye.